Good morning and welcome to the Waypoint Outpatient Mental Health Programme. Today you are visiting the Outpatient Assessment and Treatment Service, commonly known as OATS, which, along with our Community Consultation Services for transition age youth, geriatrics and dual diagnosis, will all be moving into the new Community Health Hub in downtown Midland. On arrival at the office, one of our clinic nurses will meet with you and talk with you individually about your physical health. Physical and mental health are very important. They work together and we believe in a holistic approach to care. And now I'd like to introduce you to some of the members of our team.
When a patient comes here, they're usually referred by their primary care physician or a nurse practitioner. They see one of the team members for an intake interview, then they're seen by a psychiatrist for a diagnostic interview. The psychiatrist may make recommendations that go back to the family doctor, or they may actually start prescribing medications, offering treatments, arranging treatments with other members of the team we have here at Waypoint. The psychiatrists are also involved to varying degrees in research and teaching. We offer teaching to not only Waypoint staff, but also community members, to medical students, and to specialist physicians.
I work as a community clinician, so I help out with some intakes. I also do one-to-one psychotherapy, and I co-facilitate many of the groups happening at Outpatients. And in addition to this, as the occupational therapist, I work with clients to identify the gaps in their occupational performance and then determine if we can come up with some solutions or recommendations to help address those gaps. So what this means is looking at doing some assessments with clients, both standardized and non-standardized assessments, and looking at whether the gap exists within the environment, the person, or the occupation.
As a social worker here at Outpatients, I'm part of a multidisciplinary team. We work together to run groups. Some of the groups that we would run would be the Dialectical Behavior Therapy Skills Group, which is designed for people who have emotion regulation or interpersonal difficulties. We also run a Cognitive Behavioral Therapy for anxiety, or a Mind Over Mood group, which is for people who struggle with anxiety or depression. It does take a lot of courage for people to come in and ask for help, and we understand that, and we want to make sure that we work together collaboratively to meet the client's goals and help them to be successful.
One of my main roles is to get the referral for a client and to look at it and see, so where's the best fit here? And also, as they come through their journey through our service, that the discharge is done in a way that supports the client to continue that journey. We have a really strong interdisciplinary team, and that would be our psychiatrists, occupational therapists, nurse clinicians, social workers, a pharmacy nurse. We also are able to access services from other parts of the hospital, so spiritual care, pharmacy, dietary, psychological services. So having that really strong team, I think, really provides a really holistic and complete approach to our clients.
The Transitional Age Youth Service offers specialized psychiatric consultation to youth who are experiencing serious mental health concerns or at risk of developing them. Youth between the ages of 16 and 24 are provided a comprehensive psychiatric assessment with one of our consulting psychiatrists via telemedicine. The doctor will review recommendations for treatment, recommendations for follow-up care, with the goal of supporting effective and early interventions. So most recently, North Simcoe has had some networking and partnering opportunities, bringing our community's youth, families, and service providers together to look towards implementation of a Youth Wellness Hub model at the Chigamik Waypoint Community Health Hub. The Youth Wellness Hub model integrates mental health and substance use services with primary care, education, employment, housing supports, and other community services in a one-stop shop model of care offered in a very youth-friendly, youth-informed, and youth-driven space.
Thank you for visiting the Outpatient Assessment and Treatment Services. The future is looking very exciting, and having an opportunity to have a variety of partners co-located within one central hub is a great opportunity for our clients. Working with Chigamic, the Patient Client Family Council and the Waypoint Rehabilitation Support Services will provide a very holistic, timely and easily accessible service for clients.
Welcome to Rehabilitation and Transitional Services here out of the Hero Center in downtown Midland. What we do here is we address all the social determinants of health, including housing, rehabilitation services, which also includes education services, employment services, recreation therapy, and some volunteer services as well. I'm going to introduce you to our team who can tell you a bit more about what happens here at the Hero Center.
So if somebody comes in the door, we make sure that they're either connected with their caseworker, connected with our services if they're new, or we give them the resources that they're looking for.
What I deal with are the intakes when people walk in through the door or people that have been referred to our services. So initially I will meet with an individual and I will do what we call an intake interview or an intake assessment. And in that I will cover general information about some of their past and their history. And after that I will touch more on education, employment, and recreation, their history and their interests in those realms. And after we complete our intake assessment, what I will do is schedule what we call a recovery meeting with them, and that's where they will meet with their identified supports, and they will get an opportunity to schedule a one-to-one appointment with those supports where they can begin working on their goals. Individuals that have come in that may not have a formal diagnosis will have the opportunity to meet with Dr. Sandy Plant for a one-time consultation with Psychiatric Services. So after that whole process is done and they're working independently with their identified supports, I like to do check-ins after about 3 months of being involved in their service, and then again at the end upon their discharge from our services, just to ensure that the quality of our services are on par with what they were expecting and that they had met their goals in the end.
Housing Services works to improve access to safe and affordable housing for those who are living with a serious mental health issue. Our office primarily has two roles. One is to administer the Homes for Special Care program, as well as coordinate the Road to Recovery program. In addition, we work with internal and external partners, as well as we are members on a variety of committees that address homelessness and other housing-related issues. Our office, upon request, can also be a resource center for those seeking information about existing housing resources in our community.
I work both at the Waypoint Regional Campus as well as at the Hero Center, helping all of the regional inpatients as well as all of the community outpatients pursue their goal. I will initially contact and connect with people in the hospital and start to work with them there, and then oftentimes transition to continue working with them in the community. When I work with people, I help them with both formalized educational goals, so getting their grade 12, applying to college or university, accessing funding, and I also help them with informal education goals. So it could be something as simple as studying for their G1 driver's test or pursuing their safe food handling certification. I will work with them in a one-to-one setting or in small groups depending on their comfort level, and we'll often work together until they feel comfortable enough to transition to community agencies where they can continue to pursue their educational goals.
I work here at the Hero Center to support both youth and adults in achieving their employment goals. Some of the things that I support our clients with include pre-employment readiness, on-the-job training, traditional job search skills, including like interviews and resumes, as well as job retention, which is pretty big. We also provide a variety of workshops to suit clients' needs, and these include things such as career connections and also soft skills solutions training. In addition to some of those traditional job search skills, one of our jobs here is supporting with job development, which means connecting and maintaining those connections with employers and other community partners to connect clients with creative job opportunities.
We are creating opportunities for youth aged 16 to 30 to explore meaningful and purposeful activities within the community. We work on skill development and provide resources to our youth through group and individual recreation. Some of the activities that we've been doing are baking. We do a lot of community programming. We've partnershiped with the YMCA, Home Depot, to provide some form of recreation activities within the community.
I work with the adult population, so it's anywhere ranging from 30 to 60, 70s. We can deal with senior population as well. We help to explore and develop leisure skills and enhancing quality of life and meaningful activities in the community. So some of the community programs that we offer are one-to-one individual care where we connect people to resources in the community. We provide in-house groups like, a lot of mindfulness groups, chair yoga, relaxation groups, physical exercise groups. We run an art group in the community, which is collaborating with some community players such as Midland Culture Center and the library. And then the ultimate goal is that with our support, eventually they will build the skills of independently being able to access resources in the community and living that productive, empowered, fulfilled life.
Thanks for watching, and I'm hoping you've learned a little bit more about the services we offer here in the Hero Center. We're looking forward to a bright future in our new Community Health Hub with our partners.